Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Life's Best Medicine and Low Carb MD podcast. Since I get to host both of them, I get to get the best guys on. And one of the guys who got us started, and he's been a huge influence in my life for sure, Dr. Jason Fung. He has the code for everything: the obesity code, cancer code, diabetes code, obviously, and now you're doing the fasting method. So, Jason, welcome back. So great to see you.
Oh, so great to see you too, Brian.
So, and I'm not just doing this because I like you. I need your help, Jason. I'm doing this thing on Instagram, and I open my big mouth, and I'm doing a 2-week fasting intervals with health code in between with Ben Bickman stuff. I've never been an advocate of not eating real food, but I was like, you know what? Maybe I'll just supplement that. I'm busy, and I could just throw it in the blender and mess around with it. So I'm thinking, okay, Jason, you kind of guide me on this. Now you're doing the fasting method, and I have several patients who are doing it with you, and they're crushing my spirit to see them do so well with you. But yeah, so tell people about it that don't know what it is, because I think people have this image of fasting that just freaks them out when they hear about it.
Yeah, and really the thing about fasting is that it's really effective, but it's not super fun or anything. It's not easy for some people, especially since it's not sort of in our culture these days. It's really fallen out. I mean, when people are doing it all together, like people used to do, like for religious purposes, whatever. If you're fasting all together, it does everything is just a lot easier, and that's the sort of idea. So we have this tool, but it's just getting people to the finish line and getting them to reach their goals, and that's what the fasting method was sort of. And it's the idea is to provide coaching specifically for fasting, people who know it, who have done it, low carb as well, and with the realization that it's really not just about the knowledge of what to do, right? It's kind of like saying if you have an alcoholic, right, and it's like, oh, here's the answer: just don't drink. It's like, well, yeah, that's fine. It'll work.
Yeah, that's what I always say is if you're drowning in the ocean, just breathe more air than water and you'll be fine.
Yeah, exactly.
Right?
So, just knowing what you're supposed to do often is not enough. And that's where a coach is often helpful. And it's not any different than anything else. So people have business coaches, people have like executive coaches, people have life coaches, and people have personal trainers, right? And the reason all these things sort of exist is because they're helpful, right? I mean, if you are able to get a coach, then hey, why not, right? It's something is good for you, but you need some help doing it. So the idea is to take the a model of, say, a personal trainer. Like, you could exercise yourself. You could find any number of programs on the internet, very, very excellent programs, but actually doing it is the problem. So the knowledge is not enough, and that's sort of the attitude that we have. A framework at the fasting method, which is sort of like, well, there's the the knowledge. That's only one part of it, right? Then you have the more important parts, which is the environmental part. So what is it that you can change in your environment to make things more successful? Right. And this is not a small thing. It's actually quite a big thing, because this is really the difference between, say, the 1970s and the 2020s, which is that eating is not so easily available in the 1970s. So there's not the same amount of fast food restaurants. There's not the same amount of acceptance that you can eat, in your car, at your desk, all this sort of stuff. So if you're in, if you're in the office, for example, in 1970, and you've got some boring meeting going on and the boss is droning on, well, you just sit there, right? However, in the 2020s, if somebody's ordered like a plate of cookies, you might just eat some cookies because you're bored and the boss is droning on them, right? And they're sitting right in front of you, right? So what was the difference? The difference was the environment. Not that you didn't know that cookies weren't good for you. Everybody knows that cookies aren't particularly slimming, but the difference was the environment. So, right, if you can get away from some of those things, or for example, you want some coffee, so you go down to the local coffee store, but there's not just coffee, there's muffins and there's donuts, and maybe it smells like, cinnamon, and so you want to eat something. So again, it's not the coffee that's going to trip you up, it's the fact that you're getting it from the coffee store, and now you're exposing yourself to all kinds of stimuli that are not good. So the difference is not willpower, the difference is not knowledge, the difference is tweaking that environment. So what can you do? Well, maybe you can get one of those sort of coffee things in your office instead of going down to the coffee store, for example. Or if you're able to, if you're the boss of an office, you simply say, well, you know what, there's no more food in meetings because it's not fair to people who are trying to lose weight. Or something like that. There's no more candy bowls, right? We're getting rid of those. There's no more birthday cake at the office, sort of thing. Yes, we can celebrate birthdays, but we're not going to have cake. So those are environmental things, because you get there and it's like at some points you get there and you don't want to feel like you're a big party pooper. So some people have a drink and have a cake when clearly everybody knew that you really shouldn't be having a drink and having cake, right? If you're trying to lose weight. So finding identifying these things, what is it that's going to trip you up? What is it that's going to make you fail? That's actually a really difficult thing sometimes, because it's hard for somebody to identify it themselves. It's easier for a coach to say, hey, where are you running into problems, right? What can you do about it, right? Because they have some experience with it. And then the other part, so that's the environmental part, the sort of systems part. Same thing, and that's where fasting helps you, right? Because we have talked a lot also about habits, because you got to understand that habits are extremely powerful, because habits don't require willpower. So it's like brushing your teeth, right? It's like nobody ever thinks, okay, today I need to brush my teeth, because you do it every single day, twice a day. So you don't even have to think about it. You don't think, oh, what a hassle it is to go brush my teeth, because you just do it every day. Same thing with fasting, right? If you build those habits that you're not going to eat, so the changing of your habits is difficult, but you got to say, okay, well, how can I change it? Maybe every Monday I can do this, and every month on this day I can do this. Then after the first few times, you build into the habit, and it's like, first you build your habits, then your habits build you. Because if you get out of the habit of drinking sugar, you get out of the habit of eating in front of the TV at night, when you get home, right? And so, people love that. Maybe you can switch that habit, right? So there's whole books about habits, really, about how, what small habits are, how to make tiny changes, for example, how to switch habits rather than cutting cold turkey. So there's all these things about habits that, again, are important considerations for your health, because once you build that habit, you no longer have to think about it. It just is there for you, right? And that's the sort of beauty of the trying to build the right systems that are going to keep you in place.
And that's too, Jason, why having a coach is so important, because some people are jumping the deep end and get, like, if I'm going from the jacuzzi to the pool, I've got to jump straight in. I'm not going to go a little bit at a time. And other people, let me go in and out. Let me just take it easy, or ripping the Band-Aid off. Some people just do it real slow and go, oh, I don't want it to hurt too bad. Then other people just rip it off. Okay, we're done. Let's move on. And that's what I find too with habits, like fasting, for instance. I have so many people come to me and go, yeah, I know Jason Fung. I don't want to fast. I'm like, okay, we'll just do low carb and let's get your insulin under control. Then a weekend, there's like, oh, I didn't eat lunch yesterday. I wasn't even hungry. And my energy was great. And I felt so good. And oh my gosh. And so they're feeling, and they start fasting on their own, other than me saying, oh yeah, you're going to fast tomorrow on your first day. You know what I mean? That's so scary for people to think of, because it's a big thing when they're, they have their favorite thing where their comfort is sourdough bread or chips and salsa, whatever. And if they think about not having that, they freak out, but over time they go, yeah, I really don't want that. It's not a big deal.
Yeah. And it's those little tiny changes. Where can you make those small changes that are going to make a difference when they all add up? So yeah, absolutely. And this is the thing that's often very useful is to try and find those, you see how you can change it. And yeah, that's sort of the idea of the coaching. And then the other thing that we talk a lot about, which we sort of, the knowledge is one thing. So the knowledge is everywhere. You can get it on YouTube, right? I have a ton of videos. You can get it from books. You can get it from anywhere, really. But the systems part of thing is something that's more individual, right? It's not like you're going to read a book that's going to say, hey, this is your habit and this is how you want to change it, because nobody knows what your habit is, right? So you have to work with somebody. So if you're willing to invest that in yourself, then it's worthwhile to get somebody to sort of who's doing it regularly. The other thing we do is talk, and a third big one other than the systems is the emotional part of things. So mindfulness and emotional eating and food addictions, because again, if you're addicted to foods, mostly junk foods, then it's going to be difficult for you to change, even if you know it's bad for you, kind of like alcohol, right? If you know alcohol is bad for you, but you're addicted, so you can't stop. Well, it's not a matter of just like, oh, puff it out, right? It's about getting the help you need to overcome addictions. Like, it's about counseling, talking, trying to figure out what's the deeper reason you're having these emotional issues, and getting, identifying them and trying to, see what you can do about it, right? So that's really important, because if somebody is actually, and this was very common during COVID, of course, if people are sort of mildly depressed because they're isolated, you isolate people and tell them they can't do anything, right? Everything's shut down. Well, it's going to take a toll. And obviously mental health took a huge toll on a lot of people during these lockdowns. And the problem is that people will self-medicate, basically, because if you eat sugary, highly refined foods, they light up your dopamine receptors, the reward centers, and you sort of self-medicate that mild depression with sort of rewarding drugs, just like cocaine and so on, right? They light up your reward centers. So again, understanding that, hey, maybe your problem is that you've got a food addiction here. The key is to go and do something else that's going to sort of give you that same enjoyment, whether it's, talking to friends or going out or whatever it is. Right. But identifying what that problem is sort of the first part of it. And that's not something that you can get from a YouTube channel or a book, right? It's just something that's very personal. And losing weight's not easy, right? It's one of the hardest things to do. And the coach is there really to keep you accountable. Somebody who's going to say, look, have you done this, right? If you have, then great. If you haven't, then they'll be like, why? Why didn't you do it? So there's, as with anything else, it's like, there are a lot of people who can help you along the journey, and it doesn't always have to be a doctor or a dietitian or something. There's a lot to be said for these sort of health coaches that do different things, right? They're not trying to give you medical or dietary advice necessarily. They may be there to give you advice on your environment, advice on your habits, advice on your emotions, but they're not, like, we shouldn't diminish their importance.
Well, I mean, it's critically important. Just knowing someone cares, just that little text or a little call, say, hey, we're thinking about you. How's it going? You're so many hours in. But, having Megan and Nadia, they've been through it. So they understand, they go, oh, I had that problem too. And so when someone goes through it, like learning from you about fasting, I mean, I laugh because I talk about it all the time. When I was like, this was so new to me, and I reached out to you, I'm like, oh my gosh, this guy, Jason Fung, is actually talking to me and stuff. And really, I started losing weight. My sugars get normalized. Then all of a sudden, like, 5, 6, 7 days in, my sugars are creeping back up. And so I reached out to him like, Jason, this isn't working anymore. My sugars are going up. And you're like, oh, good. That's good, Brian. You're fat adapted. That means you're releasing fat. So now when I work out, I see my sugars go up. It's not, you understand the physiology now, and, all your hard work of setting this up, but also knowing that you can reach out and go, this is weird. I'm not responding right. Oh, no, that's normal. Don't worry. And you can stay on the track and not give up and say, this isn't good for me.
Yeah, exactly. It's somebody who's done it before, right? Just like, you could do your own tiling, but if it's the first time you've done it, it's not going to look very good, right? As opposed to hiring a professional contractor who's going to be, oh yeah, this is like the, 1,000th floor I've tiled, in my life, right? It's like, oh, obviously you're paying for a bit of expertise here, but it's important, right? It's such a big determinant of health, right? It impacts on metabolic health and fatty liver and all these different sort of things that that can be done. And I don't think there's a lot of people doing it. I mean, there's different, and then, you know, again, we focus on fasting. So if that's what something that you're interested in, they have specific expertise. There's other people who do, there's other dietitians and coaches who do have different focuses, and that's fine, right? But, you know, for us, we try to sort of define our expertise through that.
And trying to figure out the optimal for that person based on what their goals are and what they're trying to accomplish. If they're, you know, diabetic, or they're just trying to lose that last 10 pounds.
Yeah,
right?
Exactly.
And so the other thing I understand from my patients, that you have a huge database of tons of talks and information and all that kind of stuff that people can tap into on their own, so they could just go and read and learn and then apply
it. So we have in the coaching, Megan's created all these, and that's Megan Ramos, for who runs the fasting method. All these handouts and little cheat sheets and all these little things, you know, for that specifically. But online you can find like all kinds of stuff. I mean, if you go on my YouTube channel, there's like a ton of videos that you can access, and I'm sure if you look online, there's a ton of other things that you can get for free if you wanted to. But you know, that's there too. Again, it's just to help people through that process. But it is a sort of you know, to expect to read a book and then, you know, it's like expecting to read a couple of books and then be a doctor. It's like, no, there's a lot of training. There's a lot of other stuff that can't be taught so easily, like with a couple of books, kind of thing. So it's those other things, that the expertise that they bring, that can be very helpful. So we, you know, sometimes I'm just stunned at some of the results that we see, like people do so well. I'm like, holy crap, it's like, that's amazing, right?
And it's
And
amazing.
like,
I mean, it's amazing. I remember when you were so excited when you were telling me about it, I was like, I can't be that great. Then I have people come off insulin, they're stopping their meds, they're getting off their blood pressure meds, and you think, yeah, like, you know, obviously one of my favorite movies was Magic Pill that you were in. I remember watching that thinking, that is insane how much people can change, come off their meds, their inflammation gets better. And, you know, when I started seeing it in my practice, I know Tro and I were talking about the mental health aspects of it. Now we have, you know, Chris Palmer coming out from Harvard talking about the benefits, and Georgia E. There's so many people out there, and you go, gosh, it is kind of weird, like a magic pill, because it's embarrassing almost, because you feel like you're a snake oil salesman.
yeah, it's crazy, especially with type 2 diabetes. And you know, I'm also working with a company called Level 2 Health, which is, again, just trying to create a program for people using dietary methods, mostly low carb and time restricted eating, as well as behavior change. And it's basically with the goal of putting type 2 diabetes into remission. What's crazy about this whole thing, of course, is that, so I wrote the Diabetes Code. It was published in 2018, but I've been writing about it since like 2013, 2014. I kept saying it's stupid for people to say that type 2 diabetes is a disease that is chronic and progressive, and there is no hope for remission, because everybody knows if you lose weight, that type 2 diabetes will often go into remission. And so finally, the American Diabetes Association in 2021 puts out guidance as to sort of what the criteria for remission are. It's like, okay, finally, a year and a bit ago, it's like, finally we have admitted that this is a disease that can be put into remission. And Dr. David Unwin in the UK had a paper where he was just using a low carb diet. He put 50% of his patients into a drug-free remission. That is, his 50% of those people who did a low carb diet with him got to the point that they got off all their medications and had gotten an A1C so low that they were no longer classified as a type 2 diabetic. And that's insanely good. Like,
yeah, people ask, like,
why
is that such a big deal? It's like, well, a big deal when you go to get your life insurance, health insurance, when they look and they go, okay, I have a pilot who lost his license, and then he put his diabetes in remission through lifestyle change, and they said, we no longer consider you diabetic and you can fly, you know, so because he wasn't taking meds and insulin. Now you go on insulin, truck drivers lose their license if they're on insulin, right? Things like that. People don't realize the implications of this.
Yeah, it's a huge deal, and also for their future risk of all kinds of diseases, but heart attacks, strokes, cancer, like type 2 diabetes is a
Dementia,
huge risk factor, dementia,
depression,
Alzheimer's, like
anxiety,
all kinds
everything.
of things. So if you can put it into remission, you're going to improve your health immensely. And there's multiple ways to do it. I'm not trying to say that low carb and time restricted eating or intermittent fasting are the only ways. There's actually lots of ways. They're just the ways that I focus on because that's the ones that have had the most success. And the studies are starting to show that. So there's Dr. Unwin's study, and then there's another study called the InterFast study where they used, again, intermittent fasting. And again, it's very similar, 50% remission rate, which is sort of like, that's just insane. If you could take 50% of your patient population of type 2 diabetics and make them non-diabetic, like that is a crazy amount of good that's being done right there. And that's what I'm working towards with level 2, which is actually part of United Health. It's sort of a company within a company. And we're trying to develop that program. Well, we are developing that program so that, you know, hopefully people can just get it right through their insurance and everything, just join level 2 health and be able to get that program. So it's a huge, like, to me, it's a huge deal. Like this is like sort of insane to be able to try to get this into sort of mainstream medicine where people can just say, okay, well, we'll just, you know, like, we'll just give people the advice, we'll help them through it, we'll coach them through it. And then by the time they get to you and me as a doctor, we just have to say, hey, your numbers are so great, I'm going to take you off insulin. Like, wouldn't that be a joy to, you know, come into the office every day, right? Oh, you're doing so good. Like, you're no longer diabetic, right? Those are the best days.
That's what we do. That's what I do, Jason. Now that I'm direct primary care, I have a vested interest in my patient being healthy because they don't bug me as much, right? Like once we get them on track, say, hey, it's like AAA. If we can get your car running, you're not going to call AAA all the time just because you have it, right? You want your car to run. So let's make your car run well. And so doing what you're doing. And I think the big thing that's opened up over the last couple of years, as you mentioned, was the importance of metabolic health. Like people didn't realize, like when you look at who was dying of COVID, you look at who was being hospitalized, intubated, and you go, gosh, we saw that they were the metabolically sick for the most part. Obviously, you know, you can't make blanket statements, but I'm saying every hospitalist I talked to said it's the same thing. And I would ask them, what's the worst prognostic sign? High glucose level, high sugars, uncontrolled sugars was the biggest risk factor that they were saying they may not respond to treatment if they're that metabolically sick.
Yeah, I mean, it is like it just cuts through all of the diseases, like almost every organ system you can think of. Heart disease, atrial fibrillation, and obesity, of course, with the lung disease, and it just cuts across all of medicine these days. So it's a really, really important thing. And those are the things that we've always been, you know, you and me, we've always been talking about, right? About, you know, the importance of being sort of open-minded about diets, dietary treatments. Like you can't use drugs for a dietary treatment. And, you know, sometimes I get attacked online for some little thing that I've said. Oh, they take one little piece. It's like, okay, you can nitpick on whatever, but what about all the other stuff I've been talking about, like intermittent fasting? Like that's a huge topic, right? I've talked so much about intermittent fasting, and you want to nitpick about this little thing that I said that is maybe a little controversial. It's like, yeah, what about all the stuff I said about type 2 diabetes, right? Like there's a ton there. It's like, all about remission of type 2 diabetes. Well, the whole world's come around. Like when we started talking about fasting, like I started talking in 2013, 2014. I published the Obesity Code in 2016, the Diabetes Code in 2018. The main things were, one, you know, let's think about low carbohydrate diets, right? The whole world's come around to that, right? The American Diabetes Association, I don't know if you know, but in their nutritional guidelines, they just put in that the low carbohydrate diet has like the most evidence behind it. The American Heart Association, in one of their scientific statements, that it has tremendous evidence for type 2 diabetics. So they've completely come around.
Yeah, and the more evidence and the more people practicing, you can't deny it. Like we're looking at ketones in heart failure, the benefits are, and you and I have talked about a lot, over the years of saying this ketosis may be your body's way of saying, look, everything's lost. We're going to give you every chance of surviving this. If you're in a famine or if you're, if you're getting really sick, your body's trying to help you out. It's not trying to kill you.
Yeah, exactly. There's nothing inherently wrong with it. It's a natural thing, right? That's what gets lost. And sometimes you think that as doctors, like you should know better, right? There's, so it was called starvation ketosis, which was just a natural reaction to not eating. Or if you're very low carb, you're going to get ketosis. And then they confuse that, of course, with diabetic ketoacidosis, which is a completely harmful state of insulin deficiency. And it's like, oh, ketones, like they're completely different. One is natural, one is a disease state. Just because it has the same word doesn't mean they're the same thing, right? It's like you're a doctor, you should know that, right? It's like you're an expert on physiology. Just because it has the same name, it doesn't mean it's exactly the same, right?
Well, and then understanding the underlying physiology. And also, I was going to ask you, like when you're doing the fasting method, do you follow ketones, or is that something you're looking at, or you're just kind of going along?
No, if people want to, right? So
yeah,
this is a whole, and this is a discussion that we have with people, because there's a whole thing about biofeedback mechanisms, right? So the idea is that, and the thing about following ketones and stuff is that you have to, if you do the blood work, it's a bit cumbersome. You can buy stuff like to monitor, but it costs money and stuff. You don't have to get those things, but it can help you. And biofeedback, the idea is that you're going to get feedback as to what your body is doing, what your ketones are doing. So you don't have to be in ketosis to get better, but if it is something that you can track. So therefore you are able to, make sure that you're doing what you think you're doing, because you're getting feedback. It's sort of like if you are shooting basketball free throws, right? You shoot it and you don't know if it goes in or not, right? You can't see it, but you're not going to ever get better, right? Because you don't know. You shoot the basketball and then you can't see what happens. Well, you're not going to know. Did you shoot it too high, too low, too far to the left, too far to the right? What you need to know is you shoot that basketball, it goes in. You shoot that basketball, you went too high, so you adjust. You went to the left, so you adjust. Right? Eventually you get better. Same thing with biofeedback, right? So if you aren't sure what's happening, then get yourself a ketone meter, or get yourself, some of these things like continuous glucose monitors for people who are diabetic, for example. So these things are highly effective, but they're basically based on the same thing, giving you feedback on what you're doing. And there's various ones that you can buy. Some are expensive, some are not so expensive, but you can decide like what you do. I think all of them can be used, to good effect, but some people don't need them, in which case you can save your money, right? But that's to say that, oh, you shouldn't do this or you shouldn't use this, that's crazy, right? Some people do it, some people don't do it.
Yeah, I think it's
personal.
And if it's a helpful tool for you, if you look, and some people, it stresses them out when their sugar's high and they go, okay, I don't want to eat that. I'm not going to eat that. It's not worth the cookies. It stresses me out, or I don't want Brian to see it, right? Or Jason to see it. So for them, it's very helpful. And plus just to educate, because so many times people are saying it says keto cereal and they eat it and their sugars go crazy. It's like, okay, that it says it on the label, but that's not keto, right? So you start realizing, okay, and like a guy like you, if you're going to eat more carbs, you can get away with it. Someone who's maybe, metabolically really sick, they gotta really get, like me, I'm trying to catch up to you. And I go, okay, what? So if my goal is fat oxidation, the way I look at it is like, okay, if you're gonna try to get your fat source, first of all, you gotta lower that insulin level down, as Ben Bickman will say. If you have a high insulin, and I'd be, as a matter of fact, as a quick aside, I have some people that are doing a ketogenic diet, low carb, and their insulin stays elevated. And it's so maddening, and it really interferes. And it could be stress, it could be sleep, it could be alcohol. Any other factors you see that where someone has a chronically elevated insulin that's just running it like in the 20 range or something like that?
Yeah, I mean, the stress is a big one. Chronic pain syndromes, we often have, we struggle to help people with those, because again, if the problem is the stress and the chronic pain syndrome, fibromyalgia, these kinds of things, right? Then until you fix the root cause, it's very difficult. Like if your problem is chronic pain, you can't really change your diet because your problem is chronic pain, right? Same thing with the drugs, right? If your problem is the diet, then don't give drugs, fix the diet, right? If your problem is chronic pain, fix that. If your problem is that you need to take prednisone and steroids, well, it's going to be really hard to help you until you can get off those steroids, right? And or antidepressants or whatever the underlying cause is, right? So you always have to look at the sort of underlying cause of what is happening, which I'm always a fan of, as opposed to those people who are like, oh, it's all about calories in, calories out. It's like, well, you're taking prednisone, right? Or it's like that, just until you get off.
If you're shooting insulin,
right?
it's gonna be a rough
If
road
you're
no matter what you
insulin,
do.
it's a tough one. Now, you're on 80 units of insulin, you're gonna gain weight. I don't really care how many calories, and that's the thing, right? It's not the calories don't matter at all. It's that there's a deeper level of understanding what is driving those calories, right? And that's something I think the nuance of which is sometimes lost on people.
Yeah, and I don't think it's just one or the other, because for instance, if I do a 72-hour fast, right, and I'm going to do an eating day and then I do a 24-hour fast or something like that, you go, okay, like you want to take some calories in that day, right? So a lot of people are like, okay, I'm gonna eat 300 calories on the day I'm eating, and then your metabolic rate can get screwed up just from the calorie restriction aspect, where your body's like, something's wrong here. You're a terrible hunter. You're gonna die pretty soon.
Yeah, I mean the metabolic rate adjustment is really what screws up a lot of these calorie restricted diets and stuff. One of the advantages of fasting actually is that sometimes the metabolic rate can go up. And again, it's pure physiology, right? It's sort of first year medical school stuff. Because if you don't eat, the counter-regulatory hormones go up, which is sympathetic tone goes up. That's the first thing that goes up, right? If your sympathetic tone goes up, your noradrenaline goes up, well, your metabolic rate is going to be maintained. Your growth hormone goes up, your lean mass is going to be maintained better than in a state where it's not. So these are sort of advantages of fasting that you might say, okay, well, let's try this, right? Again, it's not that other stuff can't work, and everybody's different, right? And so it's a matter of saying, well, let's try this, let's do this. But because the alternative, which is that, oh, it's all about calories in, calories out, calories are everything, right? It's like it's just so unsuccessful. I don't know why people are so it's
Never worked. I mean, it's never worked for all of us. I've tried it my entire life.
It's sort of like, the same thing with anything, right? It's alcohol in versus alcohol out. Hey, I just solved alcoholism. No, you haven't done anything, right? You haven't looked into the deeper reason why people are drinking alcohol, for example, which might be depression or whatever, right? Or you're just saying wealth equals money in versus money out, right? Hey, I just solved world poverty, everybody. Like, no, you haven't done anything, right? What is the reason that expenses are high? Maybe somebody, is sick and has no medical insurance, right? It's not just like, oh, the simple solution is to make more money or spend less money, right? It's no.
Yeah, and
like
I think
you're at such a simplistic level. You have to go that one level deeper and say, no, like, why are you not making the money, right? Is it that your education is low? You don't have a good job. You don't have good people skills. What is it like, right? That's the deeper level. Same thing with calories in, calories out. Yes, it's always true. However, you have to go into that deeper level because that's not the thing. I'm always reminded of this one question, which I always think is very instructive. Like if you ask people, why did the Titanic sink? The answer people mostly will say is that because it hit the iceberg. And it's like, that's not the right answer. The right answer is that it sank because it was going too fast. That's the real reason. It hit the iceberg that made it sink. Because if it slowed down, it would not have hit the iceberg. So yes, technically you're right. It sank because it hit the iceberg. But you will never fix the problem if you think that, hey, it's all about icebergs, we should have more iceberg monitoring police, right? Or something like that. Like, yes, it'll work only to some extent. If you're booting it across the Atlantic in an ice field and thinking that you can just put, people looking out for icebergs, you're wrong. You need to slow down. That's the answer, right? Same as most accidents on snowy roads.
And
You
you're
gotta slow
driving in the
down.
fog, you slow down, right? Yeah,
Yeah.
ice and
So
all
if
that.
it's like, exactly, it's like if you're in the middle of a snowstorm and you crash your car, like, why did you crash your car? It's like, because you hit that moose. It's like, no, the answer is you're driving too fast, right? That's the point. That's the same with the calories, right? Calories in, calories out. Like, yes, technically that's correct. Just like, I crashed my car because I hit a moose. You're just simply redefining the problem. You're not actually providing an answer. And that's why people are always so, like, the people who can't see more than the calories part are the people who say, no, it's the iceberg. Like, no,
Yeah.
it's the moose.
It's that
right?
same mindset, and I think a lot of it is perspective too. And when you
Yeah.
don't look at the endocrine part of it, we all know if you eat 1,000 calories of gummy bears versus 1,000 calories of fish, there's gonna be a different
Yeah.
outcomes. There's gonna be a metabolic. So to get over this whole calorie thing, obviously it matters to some degree. So if I'm doing, if I'm fasting and I'm eating 10,000 calories on my non-fasting day, it's going to be hard to lose weight just based on.
It's going to be hard. Yeah.
Yeah. But there's no reason to. The point is, and this is the thing which I think saved my life and my, steered me this way, is I had a patient lose 40 pounds. And, I was curious, how'd you lose 40 pounds? I've been trying to lose weight forever. I'm doing like Melba toast and rice crackers. And he goes, yeah, I fast. He goes, it's called the fast diet. I fast like Tuesdays and Thursdays, no carbs those days. And I was like, well, that doesn't make sense. How could you lose weight? Because you must be starving on the next day and eat twice as much. He goes, no, I'm not even hungry the next day. And I don't know why I should be. I'm not restricting what I eat. I just don't want to eat. And so people don't realize that when you're fasting. And then I watch a video with Metabolic Mike interviewing you, and you go, yeah, this is how it works. And he goes, well, why isn't everyone doing this then? You can't make money doing this. But right, it's common sense. Yeah,
it's because, like, Tro often says, it's not about controlling the calories. It's about controlling the hunger. Right? That's that level deeper that you have to understand. Why are these people eating all of this stuff? It's because they're hungry. Why? Maybe they're eating the wrong food, right? Maybe they are eating sort of junk food all day long, right? And it's not because of the calories in the junk food. It's because those foods are, the way they're metabolized, the way they're constructed, we all know they're constructed so that you eat too much, right, of these fast foods. The way they're portioned, a lot of people will eat one portion no matter how big it is, right? So in Japan, you get these tiny portions, and that's all you eat because that's what the portion is, right? So there's all these other things. It's trying to understand, why is it that you're eating more calories? Because if you've got an environment where you have American-sized portions versus Japanese-sized portions or European-sized portions. You go to Europe and it's like, whoa, look at this. It's like a third of the size of what I get in the US, right? And it's like, well, no wonder they don't have as much obesity, because this is what they're used to eating. But that you understand that, hey, one of the big cues to us stopping eating is that you finish that portioned part of your food, right? Same as Japan, right? It's just tiny.
But then the other side of the token is there's a lot of people, they're doing fine, then they get into a fight with their wife, or they're stressed out, or they're bored, they don't have anything to do, and they go, what's in the fridge, right? So for a lot of us, it's just finding that other outlet. I don't know anyone. I've never met anyone who's halfway through an hour massage who goes, you know what, I'm starving, let's stop and I'm going to get something to eat.
Or in the middle of playing basketball, you're in the heat of the moment, your team's down by 2, and you go, you're in the, last 2 minutes of the fourth quarter. How many people say, I'm really hungry? 0 people. Like, honestly, 0 people.
Yeah, so that's it.
Right?
There are some people, it's not even the satiety, that's their comfort, that's their peace, that's that like figuring that part of it out is a huge part. Like,
that's the important part, right?
Like, and sipping green tea. Right?
Yeah.
If you're, during the day, you just want something hot to sip on. It doesn't have to be a mochaccino with, tons of sugar and calories in it. You can have something that you just have a go-to that keeps you through the day, so you're not hungry.
Yeah, exactly. And that was what, that's the whole idea. And then people will always say, well, it's because you're eating less calories. It's like, no, you're getting into the underlying reason that the calories are there. Just like with alcoholism, you don't treat alcoholism with alcohol in minus alcohol out, right? You treat it with, hey, let's get you some counseling. Let's get you some group sessions with Alcoholics Anonymous, right? You don't, nobody's stupid enough to think you can treat it with just saying, it's all alcohol in minus alcohol out. It's the first law of thermodynamics, right? You can't create alcohol out of it.
And we all know if you're struggling with alcohol, it's really having that support group of people going through it. Like the fasting code, when you're doing it with more people, the fasting method is that you can like someone else knows what it's like. Oh yeah, I used to have loose stools when I first started fasting. Here's what I did. Oh, I got cramps too, and here's what I did. Electrolytes or magnesium, and so you have people who are experienced, like, oh, maybe have some bone broth when you're coming out of your fast. Those kind of things are really, really helpful, so you know what you're doing. But just to know you're not reinventing the wheel. There's people like you who've been doing it for years and years, saying, hey, look, this works.
Yeah.
Right.
We're doing it together. So we often do these group fasts where people say, okay, we're all going to do this together, right? So it's a way of staying accountable. And sometimes that's what you need, right? Just like if you go to if you have a treadmill at home, for example, you know what happens with most treadmills. Same thing that happens with
coat
most
hangers.
health club. Yeah. With most towel hangers. Yeah. With most health, those clubs, right? Those gyms, right? They sell out in January and by March, they're like half empty. That's their business model, actually. But again, it's much different if you join, say, you're part of a hockey team. You almost will never miss those games. Why? Because you're going to let down your team. You don't want to do that. So you go, right?
Yeah. Or your trainer or your buddy that you ride bikes with. He's going to be sitting out there going, where the heck's Jason?
Exactly. It's like, hey, we ride bikes every Sunday. So you go. Even if you don't want to, that's just that little thing that puts you over and says, okay, well, I don't want to let down my friend because then my friend is going to have to bike alone or run alone or whatever it is. So then you go, right? And that's the thing. And then you get the benefit of that. So yes, it's an imposition, of course, but you get the benefit of then going, right? So it's all of those little things sort of put together. So it's such a complicated, like, honestly, like weight loss, obesity, it's such a complicated thing. And that's where I get so sort of frustrated when people are like, it's all calories. It's all calories. You see all these work by cutting calories. I'm like, oh. It's like,
well, they don't understand the physiology of what you're talking about. Because if you lower your insulin with fasting, like starting the year, Mindy Pell's, my wife's like, do you know Mindy Pell? She's like, I'm like, I know Jason Fung. Who else do I need to know? And so anyway, she did this Fast Like a Girl book, and so my wife's doing it. And it's like it's really helped her a lot. She's doing great.
Yeah.
But it was nice doing it together. But I started, I'll do a 3-day fast with you. And I was like, well, it's Sunday and I had stuff going. I had to work all day Monday. So I'm like, I'll just fast these days. No big deal. And so I did a 5-day fast, which is, I don't do that very often, but it was a nice reset. But I felt so good. My focus, energy, everything is better.
Yeah, I actually think the same. It's sometimes you do it and you just feel really good during it. The problem is really the social sometimes aspect of it, right? Because you get together with friends, and more often than not, it's for dinner, it's for lunch. You have a family, like you have New Year's, and then you have this, and then, hey, let's get together for this. So it's the social part of it, which is important. That's where, it's helpful to have somebody who's like, well, let's see how you can tweak it so that it's going to work for you.
Yeah, and planning ahead and being flexible, all those things that you talk about, it's funny because everyone will say we're zealots. It's like, well, what works for you? If it doesn't work, go do something else. You've always said that. If you don't like fasting, go do something else. There's other ways. See what works for you. I mean, there's a lot of options. That it's not just one road to success. And along those lines, I have to ask you, GLP-1 agonist, what's your opinion? What are you seeing? I mean, that's, everyone goes, you don't have to fast, just do this and you lose weight and it's easy. My sister-in-law doesn't do anything and she lost 25 pounds. What do you tell those people?
Yeah, well, clearly it works. So the drug works. Like this, they've done the studies. The drug works. People do lose a lot of weight with it. And, I'm okay with that. Like if somebody is severely diabetic and need some help and they've tried this and that, well, sure, it's another tool, right? I'm not against drugs. The problem is, of course, and this was exactly the same problem we had with bariatric surgery, is that if you use that alone and you don't learn how to sort of live so that you can be healthy, Well, the minute you stop, it's done, right? And clearly the studies show exactly that. So you take the drug, you lose weight, and for the most part, I think it's just about suppressing appetite. They talk about all kinds of stuff, but that's
Yeah,
my guess.
Rafi Sertoli just released something. It's not his study, but he just showed it to me. But it basically showing, hey, look, you go from two really hypertrophied fat cells as an analogy. Your water balloons are totally full, so you can't oxidize the fat, so you can't lose weight. So basically, what it's doing is saying, okay, we're gonna have some hyperplasia now. We're gonna make some extra fat cells. Now we'll redistribute that fat, and now you can start oxidizing this fat. So now you can lose weight if it helps with appetite. But once you stop it, then you have way more fat cells to fill up down the road. And if you don't change what you're doing, you're going to fill them back up. And that's why I think fasting is so powerful, because you go, okay, if that's my goal is to decrease the inflammation, the CRP, all this stuff, why not just fast and decrease and make those fat cells more insulin sensitive now, because they're not totally about to explode. Once you shrink them down a little bit, they go, okay, I'll give up some fat now. I don't have to, everything can work pretty good.
Yeah, and the whole thing, which again, I think people wind up losing the nuances of this thing, is that if you don't teach people the habits, what foods to eat, what foods to avoid, how to think about weight loss in all of those ways, like, right, with stress and sleep and hunger and boredom and emotional eating and all those sort of things. If you never teach them and you just say, here, take this drug, it was exactly the same as, here, get the surgery, here, let's do this lap band. And what happened with that, of course, is that in the mid 2000s, I think there was a huge wave. But if you look at the number of bariatric surgeries performed, it peaked a long time ago. It peaked, like, I think in 2009 or 2010, something like that. And the number of surgeries have just gone down. Why? If you look at the studies, you think, oh, this is an amazing treatment, right? There's all kinds of studies that say you can lose a lot of weight with bariatric surgery. The problem is that everybody knows that it all comes back because you haven't learned the right habits. So you can get around the fact that your stomach is the size of a walnut, right? If you drink sugary soda all day long because you never learned the right habits, you're just going to regain that weight. That's exactly what happened. And so people saw that the demand just shrank. Nobody's doing it anymore. Years ago, I remember.
Plus, you got side effects. You got surgical complications. You got cardiac risk. It's a huge deal.
It's a huge deal, and people thought it was this sort of amazing cure-all.
The easy way out.
This is going to be done the easy way. Exactly.
Yeah, but it's not. It's a lot of work.
It's a lot of work. But now it's like, oh, you can take this drug, but the minute you, like, if you do it in conjunction with learning about weight loss and healthy habits and proper foods and how to think about foods and all the stuff that we talk about, if you do it in conjunction, no problem. If you think that you can just take the drug and not learn about this, well, sorry, as soon as you get off the drug, it's done. Your weight, all of it basically just comes back on. And that's what the studies show, right? So you can do fine for 2 years. You'll lose 15, 18, 20% of body weight. The minute you get off, it'll be back in 2 months, right? So sure, you'll lose 40 pounds. What are you going to do? Take it forever? And this is the big problem I have with the pediatric guidelines, which of course gathered a huge.
They recommend surgery and drug management.
Yeah, it's like, okay, so 12
because fasting's
years
too dangerous.
Yeah,
Time restricted eating is too dangerous.
Yeah, it's like, God, I'd rather give them drugs. But it's like, okay, but so again, I'm okay with drugs. Philosophically speaking, I am not against drugs in any fashion. It's that you need to do the right things, and then you can use drugs to help if you need to, right? So to get that first, to get going and establish those healthy habits and learn about fasting and learn how you can, sure.
The right tool at the right time.
Exactly.
Yeah.
But if you're just like, you know what, here, take this drug, I'm done. And for the most part, it's these people who really have never been successful in getting people to lose weight because they're jumping all over this drug because all of a sudden they're like, look, I'm a genius. I got these people to lose 50 pounds.
Well,
Right?
and
It's
that's
like,
the, that's the irony of life. I watch these guys pick on you saying, oh, fasting, low carb, you don't have to do all that stuff here, just shoot this drug. And then all of a sudden these guys are all promoting the drug. And now they're saying, hey, $99 a month, I'll write all the prescriptions you want with no support, anything, but you get the drug that you want. That's, $1,800 a month.
yeah.
You
And they
go,
think
crud, man, fasting is a
they,
lot cheaper than that.
but it's not just that, but it's like it's sustainable because people have done it for a long time. And the thing is that these doctors often think they're very smart. And I'm always thinking, I could train a monkey to do what you're doing, right? You're overweight, take Ozempic. You're overweight, take Manjaro. Dude, I could train a monkey to do what you're doing. It's a lot harder to slow down and think about what the problem for this person actually is, so you can actually fix the problem, as opposed to sort of paper over the problem, give them a drug that you're going to have them take for the next 50 years because, hey, you're 25 years old, you're 12 years old, I'm going to have you take this for the next 70 years of your life. Really? You think that's your solution, is it?
I laughed because I remember one time you were talking about something, you said, yeah, it makes sense as long as you don't think about it at all. Right.
That's right.
I mean, some of the steps you think about it, if you think about it for a second, you go, well, that doesn't make sense. Like, like liposuction, you could lose 50 pounds, 30 pounds, whatever they could suck out of you. But now you put yourself at increased cardiac risk because now you have to put it all in your visceral fat when you overeat, unless you change what you're doing. Right. So it all comes back to saying, hey, there's no easy way out. You can't just shoot steroids and think you're going to put on muscle sitting on your couch watching TV. People have this mentality of, oh, just go on testosterone. Well, how about if you fast and you want to increase your growth hormone? You want to do these things? Man, yeah. So I've asked you, what do you think is the best approach if someone goes, look, I want to lose 40 pounds, whatever. You go, would you do like alternate day fasting? Would you do like a 72-hour fast here and there? What would you think is the like, if you go, this is the role model of what I would do, and then you could obviously deviate based on lifestyle and stress levels and all that kind of stuff.
I mean, I usually start with having people do a 16-8 because that's easy to implement on a daily basis, because if you skip breakfast, say, very few people care. If you start skipping 3 days of meals at a time, usually at some point you run into some very upset person that you're never available to go out, or your friends start dropping you because they're like, yeah, we went out for for the game,
Taco
the Super
Tuesday.
Bowl, and exactly, Taco Tuesday, and this guy never comes, so we stopped asking him. Like, you don't want to be losing your friends and stuff, right? Because again, that's just going to isolate you and cause other problems. So I often start with a 16-8 because that's something you got to balance.
Social, having dinner with your family, all these things. Exactly.
Absolutely. And then as people get comfortable with that, then I'll start to explore the 1 meal a day, because again, if you drop lunch and you're at work, again, very few people care. And then start exploring some of the longer ones. And to do the longer ones, you mostly have to get the families buy-in and all that sort of stuff. But I'll tell you, like it's a very individualized process, and same with the diet too. And I always think that people get so dogmatic about diets but people do respond very differently. You look at these studies of low carb versus low fat. You can put somebody on and in general, low carb does better, but you look at the display, it's huge. So people will have, like on low carb, some people lose 40 pounds and some people will gain 20. And same with the low fat side, right? So if you gain 20 pounds on a low carb diet, it's the same diet as the other guy who lost 40, right? It's not the diet. It's not the right diet for you.
Yeah, it's looking for getting into fasting and looking where your insulin levels, all these things that you taught us, right? You look and you go, okay, where are you at metabolically? Because I have people who are 400 pounds that are metabolically healthy. Their insulin is normal. Their triglycerides are normal. HDL is great. And they're storing a lot of subcutaneous fat. Now, it's not great because you're carrying a lot of extra weight around, but, joint pains, back pain, all the other things, and, social stuff. But, but there's some people who are, 150 pounds that are metabolically sick. So you can't just tell. That's why it's so important, looking at the metabolic markers and understanding it, because a lot of people say, yeah, I eat cookies all day and I drink Mountain Dew and I'm fine. It's like, well, let's check and see. And then they realize, I'm pre-diabetic already,
Yeah, exactly. So it's about individualizing treatment, just like most of medicine. And I mean, that's why I think that, some of these recommendations people will look back on them and start to think, well, it's fine now. There's a huge wave of enthusiasm, but I saw it before with the lap bands and the Roux-en-Y gastric bypass, right?
Well, and Jason, all those other things are gone and you're still here and you're thriving, right? So it tells you something. If it's not working, people go, that guy's nuts, get away from him, right? That's how medicine works. So if people want to track you down, how do they track you down? How do they sign up? And explain just in a nutshell the program.
So the fasting method, you just go to thefastingmethod.com. There's a sort of a coaching part of it, which is sort of an individualized. Usually we do it in group sessions because, again, there's a lot of power in groups that you don't get with individual. So because there's not only this sort of support you get from the coach, but there's peer support. So the people who you're doing it with. So we usually try to do things in groups, and just from our experience, it just works a lot better. And then you just sign up for a coach, and usually you can do individual sessions, but you can do group sessions. And then there's also just the sort of the online program where we have live sessions. So they're not individual sessions, but you can log in and they're live sessions. So you can ask questions, you can talk, you can do whatever. And the coaches are there to do it as well. So that it's a little bit less expensive of an option, but at least, but it's not like you're getting it like a canned video, for example. Like you can get a canned video for free. I'll give it to you for free. You go to YouTube, right? And look up my name. There's a bunch of videos that you can get for free.
I probably owe you a lot of money, man, because I've watched a lot of your stuff over the years too. Yeah, for free. Thank you. So what are the price points? Do you have different price points of depending how involved
they're all
they
different.
But on the website has it.
The $39 a month is just for the live sessions, something like that. Which means you can log into as many live sessions as you want, right? But the coaching winds up being more expensive. There's packages. But it's probably in line with getting a personal trainer, right? It's hundreds of dollars, right? It's not
$1,800 a month for a drug. Yeah, and
it's
it's
not
lifelong
for a drug.
And this is lifelong. You get this
exactly.
and you get it. Once you get it, you get it. And just getting the support of getting it figured out and started. So it's life changing and life saving for people.
Yeah.
So
and it's if you're willing to invest in yourself, just like these people who get personal trainers or life coaches or executive coaches, it's more expensive because you obviously have to pay for somebody's expertise, and you're not going to get it for $40 a month, right? That's the sort of online version, which you can get much the same benefits, but the coaching is going to be sort of hundreds. There's different packages, obviously, if you do it once a week or twice a week or three, like whatever you want.
Yeah,
right?
yeah, and you can taper down one time if you don't need it, and you get most of the stuff, and that's awesome.
Exactly. So it's just it's basically like a coaching model, so that people can access that if they want to.
So in closing, Jason, what are you passionate about right now? What's your excitement? What gets you going in life, man?
Right now it's the same. Like obviously everything was on hold with COVID for a while. But now what I'm really focused on, I think, is the whole diabetes remission part of things, because again, that's closest to me as a physician. That was always my goal, because those are the people closest to end organ damage. That is, for me, it was kidney disease, but heart disease, and also those people are the closest. So the work we're doing, so not only with the fasting method to get people coaching, but also sort of try and put together a institutional program that people will be able to access through their health insurer, for example, because it's part of United Health. That's, to me, is exciting, because that's when you can get it to have it available to like 200,000 people.
Yeah,
right?
that's amazing.
Right? That'd be amazing, because if you can get it to like 200,000 people and you put 50% of them in remission, like David Unwin is doing, it's like, oh, that's 100,000 people that you've helped. Like it's just the scale is
astounding, because you can see what's coming if you don't jump in there, right?
Yeah, and the program itself with level 2, and it's called level 2 health, is as an insurance product is very good, because they put money into developing it. They're going to give you a free CGM, and they're going to give you a free Fitbit, and they're going to have the coaching for you, and they're going to have the materials, to help you with the fasting. You're going to have providers like doctors, nurses, dietitians, like the whole thing, all focused on type 2 diabetes remission. And that's amazing. It's like, and the payoff for them, of course, is that if you're more healthy, then you're not going to run up so many costs, which means that there's cost savings, which is great.
Well, we could talk about
wins.
that. Yeah, we'll talk about that. I'll get you back for an episode. We'll talk about that, because that is the huge thing. Because, you know, the model right now is the sicker the patient gets, the more the HMO gets from the government. So they want to have sicker patients because they get paid more for that. And so it's so mind blowing for us who say, oh, why don't we make the patient healthy? And then we could all go to the beach and relax and not have to do amputations and dialysis, you know? So Jason, awesome having you, man. Thanks so much. Thanks for your time. It always goes by way too fast, but we have to have you back. We have to beg you back more frequently, man.
Yeah. Just let me know. I'm always happy to talk to you, Brian.
All right. Have a great one.
Okay. You too.